Well, hi, everybody. Welcome to today's LiveWire, how to build healthcare communications that deliver exceptional patient experiences. My name is Abby Minasali, and I am a product marketing manager here at SignalWire. And we've also got my colleague here, Luca Predavera. He is the lead solutions architect. He's giving us a thumbs up. And he's here with us as well to answer any questions. Before we get started, I do have a few housekeeping things to go over. Here's Luca and his cat. What's your cat's name, Luca? Oh, I think you're muted.
Julius. Joining us today.
Wonderful. Well, welcome, Luca and Julius. Some housekeeping things to go over really quickly. We will be sending a copy of the following slide deck to everyone after the presentation, and we will also be providing a recording to anyone who's interested in watching it, whether it's you or somebody you work with. If they want to watch this after the live event, that will be available. And please feel free to ask any questions that you have. We do have a chat button in the bottom right-hand corner, and we've got a few people on our team in the audience today who will be trolling the chat and answering questions for you in there. But we'll also be doing a live Q&A session at the end, so if you'd prefer to save it for that, that's all right as well. Just to go over our agenda today, we're going to be going over some market trends in the healthcare industry. And then we'll move on to use cases and take a detailed look as to where communications touch the patient experience. We're also going to go over how to build an omni-channel solution with SMS, voice, and video. And then we're going to take a look at a real life case study and take a look at how Phoenix Children's Hospital found success using SMS. And then we're going to go over some very cool live demos that we have prepared for you to give you a little bit of inspiration. And then we'll go on to that Q&A session I mentioned earlier. So let's get started. All right, so a lot of research has been done. A lot of research has been done to analyze how mobile health can improve patient experience and improve efficiencies in a healthcare setting. So when we're talking about mHealth or mobile health, we're specifically talking about the use case of mobile and wireless technologies like phones and tablets to support health objectives. And that includes mobile apps as well as messaging, text messages, voice calls, and video chats. Whereas in comparison, telehealth is a broader term that we will use to describe the use of any technology to provide patient care from a distance. So that does include everything I just mentioned, but it also includes other technologies such as wearables and things like that. So research shows that digital front door services like patient portals, pre-registration, text messaging, online scheduling, and virtual waiting rooms are very important to patients. And the overwhelming majority of clinical staff advocate for mobile use and strongly support its wider deployment. And then when we take a look at the market, when it comes to the market, we can see that 75% of hospitals have been reporting that clinical communications and collaboration investments are a high priority for them. In fact, if we take a look at 2021, the value of the global mobile health technologies market was at about 55.4 billion USD, and it's estimated to grow to $224 billion by 2026. And while certainly an accelerator, we can see from this data that the growth and interest in communications technology in the healthcare setting is not just limited to a temporary spike from the COVID-19 pandemic. Both patients and doctors see the need for better communication, and the market is backing that up. As of 2021, 49% of US hospitals had already developed enterprise-wide mobile communication strategies, and 42% of US hospitals were in the process of developing these mobile communication strategies. That means there's only 9% left of US hospitals who are not investing in resources in communications. And we can see from this data that mobile health is no longer optional. Patients are starting to expect certain features like appointment reminders and automated call handling and virtual appointments, and they're not willing to settle for less. So why do patients and care teams find communications technology like messaging, voice calling, fax, and voice so important? Well, healthcare is very incredibly sensitive. Unless it's for a routine checkup, people aren't going to the doctor because they're feeling well. Usually something is wrong, right? And even if it's not, even if it is routine, it's a very vulnerable experience. So we have to make sure that we're doing everything we can to make that customer or that patient experience as comfortable as it can be. So by having multiple options for communicating, patients can choose how they reach out to their healthcare staff, which increases engagement. And when care providers can meet their patients where they are, it builds trust and stronger relationships. We're also going to be discussing how mobile health can be used to improve patient care and improve health results themselves. And as we talked about a few slides earlier, patients are also starting to expect options in communication from their healthcare providers. And it's shown in studies and in research that patients are more likely to choose a provider if they have mobile health access. But mobile health isn't just for patients, it's also for the healthcare providers themselves. mHealth can also save healthcare staff time and save clinics money. We can use things like appointment reminders to avoid skipped appointments. We can increase patient recall by sending automated reminders when it's time to book a follow-up or a routine checkup so that we can ensure that our patients are coming back and having a good experience. We can also get a little creative with our voice deployment, and we can put an end to staff sitting around on the phone waiting to talk to patients and manually making appointments and save them some time as well. We could do things like setting up an IVR that allows patients to call in and make an appointment at any time of the day, fully self-service. In fact, I've got a little bit of a surprise demo for everybody towards the end of this presentation, but I don't want to give too much away. In the next few slides, we're also going to be discussing how mobile health can improve staff efficiency and the quality of communication internally in these clinics themselves. So when we talk about exceptional patient care, there are two prongs. There's external communications, which is when staff are communicating with patients, families, or other members of a care team, like family members or pharmacies. And then there's internal communications, which is how healthcare staff communicate with each other. So on this chart that I have up on this slide, we've got 4 icons representing different pillars in communication. We've got voice, which is any use case that involves phone calls. We've got messaging, which includes chat as well as text messaging. We've got video chat and video conferencing. And then, of course, we have fax. All of these pillars can be used to build standalone applications or implement increased functionality in existing patient portals or applications that already exist. So when it comes to internal communications, evidence suggests that mobile technology has the potential to significantly improve communication and teamwork in hospital and healthcare settings. Failures in communication actually contribute to more than half of all patient safety events, which is a very surprising and worrisome statistic. It's also found in research that texting or calling colleagues directly on their mobile devices rather than paging them has been shown to save critical time in emergency cases. We can put this data to use and apply it directly by creating something like an internal network for staff to communicate with each other. And that's a huge use case for voice and SMS. So using something like SignalWire's APIs, you could create temporary connections between phone numbers so that doctors and nurses can text and call each other without having to give out their personal phone numbers, which is a really big one for privacy, as well as work-life balance. I'm sure the doctors and nurses would really appreciate not getting work texts in the middle of the night. But on top of that, you can also text back and forth on devices that aren't mobile. For example, like a tablet that's connected only to the internet, and you can have an entire internal network connected to tablets that you give out to your staff. In a hospital setting, staff are often in different physical locations from each other, which is a very big blocker to workflow communication. So for example, if a nurse needs to get in contact with a doctor from a completely different wing of the building, or even just a different floor, it's much more efficient to send them a text with a question or make a quick call to get some more clarifying information. In fact, 80% of hospital staff cite that SMS is their preferred method of communication. And we see a lot of use cases with SMS in healthcare. It, of course, can also be used to send notifications and reminders to care staff themselves. For example, reminding employees to check their temperatures before coming into work if there's been an outbreak of the flu or during the pandemic. Workflow can also be improved using video chat as a way to communicate with staff in a matter of seconds, no matter where they are. Think about the platform we're in for this LiveWire right now. We can build something similar, but for a healthcare application and create an internal office that's all over the browser and all online that you can access through video. It's a great way of communicating with staff quickly. So we can actually build something like this with video APIs to create virtual offices, like I mentioned, so that staff members can have those quick access to face-to-face conversations without actually being in the physically same space. So for example, think like a primary care provider suggests to a patient that they should see a cardiologist. But before they do that, they need to get a few routine tests done before their specialist appointment so that they can be ready and have the data they need. That physician can then schedule a meeting with their in-house cardiologist to describe their patient's symptoms and chat about what's going on, and then decide from there which tests to order for the patient, all streamlining the process and making the workflow a lot easier, all from within a patient portal even. And of course, in the healthcare industry, we always will have fax. It's widely used internally for things like sending nursing orders and transferring medical records. And with APIs like we have here at SignalWire, you can use programmable fax to enable fax on your applications, which allows for traditional communication to blend seamlessly with any cloud solutions that you have. So there are also a few ways to apply communications to external communication. So let's take a look at how each pillar touches the patient journey when it comes to external communications. So when it comes to voice, we of course have the application of doctors reaching out to patients over the phone. And with a platform like SignalWire, doctors can use that same temporary connection we mentioned earlier to call patients from a personal mobile device or even a tablet if it's on voice over IP without giving out their real phone number. Patients can also make calls directly to a doctor right from a patient portal just by clicking on a button. Voice can also be used to send automated reminders to patients, just like we see with SMS, to remind them of things like refilling prescription or book follow-up appointments. And that would look like sending a recorded message saying, hey, it's time to refill your prescription. You're about to be out, but first you have to come visit us for a follow-up appointment. This is an especially popular use case amongst elderly patients, as they often prefer communicating over the phone. In fact, according to one study, 78% of consumers want to be able to schedule their own appointments at any time, day or night, from their home or mobile device. And this goes across all age groups. And yet, despite the demand, only 40% of providers are currently offering this functionality. So one way we could fulfill that wish using SignalWire is through something like an advanced IVR. And for those of you who don't know, an IVR is short for interactive voice response system. So essentially, it's the machine that answers your calls for you, and you can trigger actions depending on which buttons you press, like forwarding a call to a different department or leaving a message. So with SignalWire, we could take something simple like an IVR, and we can turn it into an experience that saves patients time rather than getting them stuck in complicated phone trees, which is a personal pet peeve of mine. It drives me crazy when you get stuck in those phone trees for hours and you still don't end up in the right place. But we can avoid that. For example, we could connect a phone number to an artificial intelligence engine, and we can have a virtual agent answer calls and make appointments for us. We could also use this to quickly route inbound calls to the right department without having to waste staff's time. In fact, that's a bit of a spoiler alert for my demo coming up later in the presentation. So, everyone get excited. But before I spoil anything else, we'll move on to messaging. Messaging, of course, can also be used for talking back and forth with patients, whether that's over chat or over SMS. Messaging is a super quick and accessible way for patients to get in contact with their care team, to ask very quick questions or quick clarifications. But messaging can also be used for things that we don't think about right away, but are just as important, like two-factor authentication to protect our account privacy, or other account notifications that may be involved in your patient portal or privacy for your patients. Of course, we've also discussed the use of appointment confirmations and reminders. It's a great way to avoid missed appointments. Patients are 99% more likely to see notifications over a text message as opposed to something like email. It's the most widely used way to communicate with someone in general. You always get the best read times with text messages over email, whether or not it's a healthcare setting or otherwise. And we can use that knowledge to do things like send automatic reminders to book follow-up appointments, sending an automatic reminder every 6 months, for example. And again, that's a great way to increase patient recall. I've also seen some really, really cool creative use cases that I was surprised and excited to learn about. For example, at hospitals, when a patient opts in, they can send text messages to members of their care team, like friends and family, during surgeries that they have, so that their friends and family don't have to worry about how things are going. One study on this showed that 94.2% of family and friends felt more connected to their loved ones during a surgery when they received these perioperative text messages. And that is a huge win when it comes to improving patient experience. My last messaging example is all about helping patients who need things like chronic care for conditions like diabetes. So for example, maybe a patient who's newly diagnosed might want reminders from when it's time to check their insulin levels because they're not used to having to do it, or reminders when it's time to replace equipment. Even those who have been dealing with chronic issues for a long time may benefit from receiving these care reminders. In fact, actually in New Zealand, one healthcare company got very creative and they started offering a program for smokers who were trying to quit. And this program would send text messages periodically throughout the day that offered encouragement and advice and tips and tricks and warm wishes. And the program was actually so successful in getting people to quit that the government bought that application and is now providing it for free to anyone in the country who is trying to quit smoking. So there are so many ways we can get creative with these use cases. Onto video. While COVID-19 certainly did propel the use of video appointments, telehealth has proven that it's here to stay. 51% of consumers are reporting that they want to have telehealth options, and it's even higher when we get specific, like we look at psychiatric care, for example. That number gets even higher. And video APIs are a great tool for building telehealth offices that go above and beyond more than just a video chat. So for example, those virtual offices we talked about earlier, we can also set up virtual patient rooms. So just like in a real office, patients can move between room to room, as well as nurses and doctors. So for example, a nurse can easily see in a virtual office who's in which room, and they can pop in and out and ask those pre-appointment questions where they ask you about your medical history, and then they can pop into the next room. And then when the patient is done with their appointment, they could be sent to the virtual receptionist desk to talk about things like insurance issues or scheduling follow-up appointments. So the best way, well, and then of course we have fax. For internally, we're looking, or externally, we're looking at things like sending prescriptions to pharmacies and talking to insurance companies. But of course, the best way to use communications technology to improve patient experience is to use all of these tools that we just talked about in order to build an omni-channel solution. So as an example, let's walk through a hypothetical patient experience. So this is our patient. Meet our patient, Fred. Hi, Fred. Fred is not feeling well, unfortunately. He's been very, very tired lately, and he's been getting these awful headaches, and he doesn't know where they're coming from. So his first step is to make an appointment with his doctor, of course. So he can either book an appointment online on your patient portal, or he can call in, where he'll interact with something like an IVR. Fortunately, Fred is a night owl, and it's 2 a.m. for Fred, so he's not going to get on the phone with any agents. But he can be connected to an AI agent who can help him book an appointment and figure out which department he needs to go to. So when his appointment is booked, he gets an SMS confirmation for his appointment so that he doesn't forget. But Fred is very forgetful, and if it weren't for his reminder, he probably wouldn't have showed up. So now we've got a reminder the next day saying, "Hey, Fred, don't forget about your appointment today. We'll see you at noon with Dr. Geek." So Fred goes into his appointment. He talks to his doctor. He has to get some blood tests to see what's wrong. And the next day, his test results are finally ready. But there's no reason to drive all the way back to the doctor's office again, a second day in a row. So he receives a text saying, "Hey, Fred, we can go over our video, or we can go over our test results over video. All you have to do is click this link that I just sent you. When's a good time that works for you?" So Fred talks to his doctor over video chat. The doctor prescribes him some heavy vitamin D pills because Fred is from Wisconsin. And then the doctor is able to move Fred into a receptionist video room so that he can fix issues with his insurance because he just changed jobs. He gets all of that sorted out, all from the comfort of his home. And after everything's sorted, Fred is feeling way better. He picks up his prescription and everything is looking good. All right, okay, let's do one more example. So now everybody meet Paula. This is Paula. English is Paula's second language, and Paula has a surgery coming up to fix her hip that's been bothering her. So Dr. Fred, hi Fred, wants to go over pre-surgery preparations with her, like when she needs to start fasting and what accommodations she's going to need when she's discharged and healing at home. So Paula's daughter, Mirabelle, is usually the one who helps translate things for Paula, but unfortunately she's out of town and couldn't avoid it. So during Paula's appointment, Dr. Fred starts a video chat room and invites Paula's daughter, Mirabelle, into the room because she's part of Paula's care team. So then Mirabelle is able to listen to all of Dr. Fred's instructions just to guarantee that Paula doesn't miss anything and she knows exactly what's going on. Then a few days later, Paula is actually in surgery, and Paula's daughter gets a text every few minutes from their care team updating her on how things are going. And this text message you see up here is actually a real life example of how some hospitals have been using text messages. They'll say, "Hey, Paula's been seen by the anesthesia team. She's now cleared for surgery. Hey, we're halfway through Paula's surgery and everything's going routine and going as planned." You can see how this would really, really calm the nerves of family and friends and make them feel more connected to the patient. And then when Paula is out of surgery, her daughter is able to then click the link and get on a video call with her so she can support Paula and make sure everything's okay and she's feeling all right, even though they're at a distance. So now that we've gone through some hypothetical use cases, I wanted to talk about one of our customers who has been using SMS, Phoenix Children's Hospital. So Phoenix Children's is a nonprofit children's hospital, and they are one of the largest pediatric healthcare systems in the country. And they also have the most comprehensive children's care facility in the state. They provide inpatient, outpatient, trauma, and emergency care across more than 75 subspecialties. So a little while ago, I actually had the pleasure of speaking with their Chief Innovation Officer, David Higginson, to learn more about their implementation. So Phoenix Children's Hospital adopted texting as a more effective way to reach both patients and their employees, rather than having them log into an application or patient portal. They could take communications into their own hands and make sure that everyone would read them immediately instead of waiting for them to log into a portal. So they use SignalWire's SMS messaging APIs to send one-way text messages with important updates such as lab results, and they also provide two-way communications where doctors can text back and forth with their patients. So this is a real life use case that's still happening right now. They found great success with it. They found that their employees and patients prefer to communicate through SMS, which just backs up the data that we heard earlier, as opposed to getting stuck in long phone trees or having nurses take time out of their busy schedules to make phone calls. Now they can focus on more important things like patient experience. They also use various text messaging campaigns to send things that we discussed earlier, like appointment reminders. End of visit summaries is a big one that we haven't talked about yet. Booking follow-up appointments, sending updates to patient or parents with patients in surgery. It's especially important when you're working with children, and talking back and forth with doctors, and many more cases. So one big one I wanted to hit is before they adopted text messaging, Phoenix Children's would only call a patient if lab results were positive. And this was common practice. It saves staff a lot of time. It can be very time consuming to sit and call every single patient, especially when there's nothing to talk about. But this caused parents to worry a lot, and it's a very sensitive topic, especially when we're talking with children. Parents were worried when they didn't hear anything back that maybe the test results got lost, or there was a problem, or they forgot to call, and they were very anxious waiting for those results. So with SMS, Phoenix Children's actually started texting their patients a link to the lab results as soon as they were available. So that relieved a lot of stress for their patients, and more importantly, their patients' parents, because they weren't sitting around refreshing a page, sitting at the laptop, waiting for the test results to come in. They could go about their lives and wait for the text message, and they knew that as soon as the information was available, they would have access to it. And of course, that's all automated, so we're not spending any manual time from clinic staff. Their SMS usage was also increased during the height of the COVID-19 pandemic, as the hospital would text their employees reminders every day, telling them, hey, take your temperature, don't forget to wash your hands before you come into work, as well as distributing COVID-19 test results to patients as fast as possible. With such important use cases, high throughput was a very large priority for Phoenix Children's, and makes sense. Throughput and deliverability is very high up on the list of priorities for a healthcare use case, because you can't afford to miss a notification or a message. That could be a very important message that you're missing. So Phoenix Children's had been using text messages prior to using SignalWire, but in 2019, they switched over to SignalWire and started using short codes, which is one of the types of phone numbers we offer, in order to increase their throughput. So they started out by sending about 130,000 texts a month, and they grew very quickly up to 500,000 text messages a month. And they have had, David told me, they have had no deliverability issues, no issues getting messages blocked from mobile carriers or anything like that. And that averages about hundreds of thousands of texts a day, which is also a testament to how many different use cases there are for these technologies. David also let me know that SignalWire SMS APIs, he found, since he is a technical guy himself, he found them very easy to implement. And this text application that they built was up and running on the SignalWire platform within a day, which is also very important when adopting new technology. People can be skittish if something is going to take a lot of time investment, but this is something that can make a huge impact that takes less time than you would think. So when it comes to the SignalWire platform itself, we've got a few things that I'd like to hit that really make us stand out. And these are all testaments from customers that we've had in the past. So first of all, like I said, we're incredibly easy to use. We offer easy to use APIs that range from low code so that you can copy and paste stuff all the way up to high flexibility, which makes it quick and easy to deploy communication solutions to patients. It also makes it really easy to customize what you want your application to look like and how they work together. We also offer compatible APIs with some competitors, so it's fast and easy to move over from a different provider. If you're moving from a different provider over to SignalWire, you can do that in about 5 minutes. We're also very secure, which is important in use cases like this. SignalWire APIs are designed to help with HIPAA compliance and protected health information requirements. And we are also prepared to execute business associate agreements to qualifying customers. That's something we'll hit on the next slide, but if you're interested in that, reach out to our sales team and we can talk to you more about that. We're also incredibly reliable. We're proud to offer a 99.99% platform uptime, which ensures that you're always available to your patients. And when you work directly with our teams, we can help you strategize and navigate the carrier world so you do not have to worry about it. And we can get you the highest deliverability and throughput possible using our SMS APIs. Our team are all experts. So not just the carrier ops team when it comes to reliability, we also have an expert support team. So you have 24 access to US-based support. So you never have to delay development processes to wait for answers. And you can also get any issues that do arise fixed ASAP. So time is of the essence. We can get things fixed as fast as possible. Everyone on our support team is either a developer themselves or a technology expert. So we really know what we're talking about. There's none of that, oh, let me go ask the next person. Let me go next to the next person. We get things done quickly and efficiently. We also have a complete solution, which is great when we're talking about building these omni-channel solutions. We've got a fully integrated suite of communications APIs that includes voice, messaging, and video, which helps you deliver truly omni-channel communications experiences for patients. We're also pay-as-you-go. If price is an issue, you can actually save up to 50% depending on who you're switching from when you switch over to SignalWire. And it only takes about 5 minutes to switch. And you're only paying for what you use. So you're paying as you go. And you can also gain access to volume discounts as your traffic scales. When it comes to scalability, our developer-friendly Elastic platform is built to automatically scale as you increase your traffic, so you can grow as you go. We can easily scale up and down automatically without you having to worry about any of the back-end complexities. You can just focus on getting your application to work and your use case. I just wanted to touch really quickly, I won't take too long on this, but the campaign registry I mentioned a few times, and this applies to anytime we're sending text messages or SMS or MMS. So the campaign registry is an entity designed to establish a common standard for application to person messaging. So anytime an application is sending a message to a person. So all you have to do is register your use case to the database, and this was put in place to prevent spam and abuse of text messaging traffic lanes. And when we say registering a campaign, I know the first thing that comes into people's mind is marketing. Well, I'm not marketing, I'm sending updates to my patients. Campaign in this sense is just another term for what your use case is. So all we have to do is register your use case to this database so that we can keep spam off of our channels. And this is a universal thing. Anyone who sends SMS traffic on any platform with any provider has to go through this. So some examples of use cases that would apply here that will definitely get approved are things like two-factor authentication, account notifications, any of those customer care examples that we talked about, and even things like delivery notifications. If you're a pharmacy, you can send text messages to your customers to let them know when your prescription has arrived. Like I mentioned, we have a team of carrier ops experts. So when you meet with them, we can make sure that your campaigns get approved on the first try, and we can help you strategize to get the highest deliverability and the highest throughput that you possibly can. We have a few experts in the audience today, actually. So if you have some questions during the Q&A session, we can ask those. Now. And then lastly, we also have a brand new TCR wizard. That's the Campaign Registry, TCR, up on our space. So if you want to go through and fill out all of your information there, it makes it really easy to let us know everything we need to know to get you approved for those campaigns. And lastly, this slide, I know it breaks every single PowerPoint rule ever made, but I'm not going to go over all of this text. I just wanted to make sure that when you all have a copy that you had all of the information about HIPAA and security. I'll just summarize this slide by saying SignalWire is a fully HIPAA compliant platform, and we are able to sign BAAs to qualified customers. So to learn more about that, please contact our sales team. That's sales@signalwire.com. And we can promise there's no personally identifiable information, private resource logs, or other records that are publicly accessible. It's all private. You have to have specific access granted by a space administrator in order to see any logs in the dashboard, and you have to have API credentials. The only thing I would add to that is we do recommend that each application that programmatically accesses SignalWire uses its own API tokens so that you can easily see when a token has been used and remove it if that becomes necessary. Again, if you have any specific questions about that, please reach out or ask us during the Q&A. Luca is an expert on that, so he can answer any of your questions. And now I've got a very, very exciting demo to show you. I gave you all a little bit of a sneak peek, but we are going to be looking at a working prototype of an artificial intelligent virtual assistant that will answer our call. We're going to call into Dr. Geek's office, and we're going to see if we can make an appointment there. And the AI is going to decide whether or not we should come in for an in-person video, or if we should come in for an in-person visit or have a telehealth video visit. So I'm going to pull out my phone. Here, maybe if we can make oh yeah, you guys can all see me pretty well. So I'm going to call this number. It's a pretty catchy number. It is 640-CALL-DOC. I thought that was kind of funny. I can see the billboards now. It's a good advertisement opportunity. So I'm going to put it on speakerphone.
Hello, thank you for calling the doctor's office. My name is Amy and I'm here to help schedule your appointment today. Before we proceed with scheduling an in-person visit or a virtual video visit, may I ask if you have experienced any COVID-19 symptoms such as fever, coughing, or shortness of breath within the last 14 days?
I don't have a fever, but I do have a cough, and I have been a little short of breath.
Thank you for letting me know. Based on your symptoms, I would recommend scheduling a virtual video visit with the doctor instead of an in-person appointment to ensure everyone's safety and well-being. Would that work for you?
Yeah, that works.
Great. I can help you schedule a virtual video visit with the doctor. May I have your phone number, please?
Yeah, my phone number is 262-252-3272.
Thank you. Before we proceed, I need to ask a few more questions for the doctor's screening process. Have you traveled outside of your state or country within the last 14 days?
Yes, I traveled out of Wisconsin. I'm in North Carolina.
Thank you for letting me know. Based on your recent travel history, I would recommend that you get tested for COVID-19 before scheduling a virtual video visit with the doctor. Would it be possible to schedule an appointment after getting tested and receiving negative results?
Yes, that would work.
Great. Please get tested, and once you receive negative results, please give us a call back at this number +1-26230-36388 to schedule your virtual video visit with the doctor. Is there anything else I can assist you with today?
I changed my mind. Could I schedule an appointment for next week?
Sure. I can help you schedule an in-person appointment for next week. May I have your phone number and the reason for your visit?
Yeah, again, it's 262-252-3272, and I've been having a runny nose and a headache.
Thank you for letting me know. Based on your symptoms, I would recommend scheduling an in-person appointment with the doctor. We have availability next week at 10 a.m. or 2 p.m. Which time works best for you?
2 p.m. is better.
Great. I have scheduled your appointment for next week at 2 p.m. Please arrive a few minutes early to complete any necessary paperwork. Is there anything else you need assistance with today?
No, that's everything.
All right, then. Thank you for calling the doctor's office and have a great day.
All right. And then it hangs up and we're done with our appointment. And if we're deploying that in a real life situation, it would automatically schedule an appointment for me all over the phone. That's satisfying our need for wanting to make an appointment at any time of the day. It's saving our patients time. It's saving our staff time by answering phone calls. It's also saving our patients time by having to call in and wait on hold for a nurse to answer the phone, which has happened to me multiple times just in the past few months. And it's also showing how fast we can stay up to date with trends. Investing in communications isn't something that has to be a lengthy process. It's something that you can get out of the door in a matter of a week. It's things that we can launch immediately and stay up to date with the latest technology, so that we can make sure that we're meeting customers exactly where they are, making them as comfortable as possible, and using the technology that's available to us in ways that are helping us to improve our patient experience. So this is actually built by connecting SignalWire, our voice APIs, to an AI engine. And that's what's triggering that call and messaging actions based on those conversations. So all of that is handled by SignalWire. And this is actually going to be available soon in the future as a low-code kind of product that you can use and integrate directly into your platform. So keep an eye out for that. Make sure you're joining our Slack community, signalwire.community. And also make sure that you're subscribed to any of our newsletters. We are always making announcements about webinars, but also upcoming products as well. So make sure you're staying up to date with that, and reach out to our sales team if you want to hear more, not only about our AI connector, but also anything about HIPAA or any questions you have about anything we discussed today. Again, there are so many different applications for all of these tools. All we have to do is get creative, and thanks to SignalWire, it makes it really easy to take these very complicated tools like AI or telecommunications, which takes years to master, and you can harness those powers in a matter of minutes, so that you can just focus on your user experience rather than complicated backends and mastering artificial intelligence technologies. So I'm going to throw it over to Luca now. I promised you he's got some pretty cool things to show us as well. He's going to be showing us a few examples and helping answer any technical questions that you have about anything you heard in the presentation, or if you want to tell him a little bit about some things that you were thinking about building, he can help you out with that as well. So here is Luca.
Hello. So more on the technical side, I wanted to show how the same code could be used to do different things, such as doing voice reminders, using SMS reminder, or even using a video channel. Of course, the AI bot is cooler because it does more things, but then you could tie them all together. So have the voice bot work through the various channels that we have available. First channel is simply doing a voice reminder, which is a call similar to what Abby just did, but mine is less interesting, but I still run it. My phone will eventually ring at some point. And okay, press 1. Well, oh, I have no audio actually. Well, so the same thing can be done with so voice is the same as video Abby just showed, but the same content can be sent over SMS using a simple queuing mechanism. So I got an SMS sent right now, and the message is going to show here in my dashboard because that way I can just show it to you. Here it is. What I got is a link to the same a start of conversation to the same appointment, so I can respond with 1 or 2 and go through the same steps, which or simply confirm the appointment, yes or no. Same thing goes with chat. The more interesting thing will be to go through video. So this is very interesting. I'm sending out an SMS to join a video room on SignalWire. So this is how seamlessly you can bridge the two together. So this is the content of the message I received. Just copying it from here, because copying that long string from my computer, my phone, will be complicated. And I'll paste the string I got through an SMS here, and in just a few seconds, I will be talking to each other. Wow. So all of this is pre-built. All of this is very low code, and it's generally very easy to set up and run. Here we go. So here's myself talking to myself on the SignalWire platform through an SMS reminder we sent over our SMS channel. So that's not as much as a reminder, but it's more of a link to join the room. But this is just all very simple to build and easy to do. Just a quick look at the dashboard, because Abby touched on a lot of subjects. Our dashboard is very easy to use. It's got a few things going on. So of course you can always set up video. You can always keep your consumption of the various APIs under control. And what's really I did a little traffic on Tuesday, and you can buy phone numbers, which you can then attach to various applications. What Abby was referring to during messaging is the use of Campaign Registry. Campaign Registry is how you set up your numbers to send messages, especially in the US, with the proper protection and the proper campaign set up so the carriers will not reject the messages. It's super easy. We have a wizard right in the dashboard to set that up. We have something interesting like a Dialogflow integration. Aside from the AI bot that Abby worked with, we also have the ability to support traditional chatbots using Dialogflow. We have a full-blown integration with Dialogflow, including that we are the only true telephony partner for Dialogflow, which is very useful in case you need to write bots that fill out forms, such as ask a set of questions where you need specific answers, like what's your what date you'd like the appointment be at, what time you prefer, etc. We have many other integrations that can be ran, such as video. You can just appear to build integrations and integrate with existing FreeSwitch servers to help you build on top of your infrastructure. It's so simple, API based, and we have a usage dashboard that helps with all other capabilities and listing all the traffic that you just did. How this works is very simple. You just use you just go to developer.signalwire.com, start taking a look. There's we have many different APIs available, and especially we have guides for each one of the setups. The demos you saw were built using, or just if you're curious, using our voice SDK, using our real-time SDK, which is in here. So the real-time SDK is the more advanced of the various SDKs we have, and it's WebSocket based and enables low latency communications, which is very important for voice-based applications such as chatbots and AI. We suppose this is built in JavaScript, but most of the communications are actually happening using a REST API, meaning that you can work through it with any client, any language you like. And video also has a very low-code integration, which you just saw, that allows you to simply run a conference without having to do anything special. This is the room we just saw, including the fact that you can get embed code, paste that in your page, and done. You're already joining the conference. This is useful in case you want to do things like WordPress integration, or simply generate a page where you can meet with your customers. And it's copy from here, paste in your page, done. More of these are coming, including click to call and similar components, and maybe some kind of chatbot in the future. But we're building more of those because these are very popular. So low code, you got it. API, you got it. Dashboard helps you with anything else, and me and my team will always happy to help anyone that gets started on SignalWire. So hit me up for any questions.
Great. Thank you, Luca. Speaking of which, We've been talking enough. Let's hear from everybody else. Does anybody have any questions? We could even ask Amy some questions. We've got some questions for Amy. You can either put them in the chat or there's a hand raising button. If you click that hand at the bottom, it'll turn your video green. Anybody have any questions?
So I have a question.
Yeah.
So the bot that you use today, is that Dialogflow?
It's not actually. We do offer integrations with Dialogflow, but we used a different, newer AI engine in order to build that. But we do offer integrations with Dialogflow as well.
What about the bot that you used?
I do believe we used OpenAI for that prototype. Yeah, so very popular with the chat GPT stuff.
Great presentation.
Thank you.
Really good.
How are you typing if you have no head? Does anybody else have any questions? Great. Well, I'll just close it out. If you think of any questions after the fact, you can message us. You can message Luca, very easy to remember, luca@signalwire.com. Abby@signalwire.com. I will be sharing this presentation with everyone who registered. We're also offering, we're going to be sending the recording of this to anyone who registered. So let us know if you have any questions. Please reach out. We'd love to help you out. And thank you all for attending. I really appreciate all of your time.